First, what is telehealth? According to the U.S. Department of Health and Human Services, telehealth is the use of electronic information and telecommunications technologies to support long-distance clinical healthcare, patient education, and public health and health administration. In short, telehealth helps you visit with your doctor using video conferencing, the internet, and other types of media without having to go into a hospital or clinic. It is important to know when to use telehealth and when to see your doctor in person. Telehealth appointments can be used for many different healthcare services, including being able to talk with your doctor when the office is closed, refilling a prescription, getting a test or lab result reviewed, or asking your doctor questions about your health. Using telehealth to see your doctor has many benefits. Telehealth saves you a trip to a hospital or clinic, which is very handy for people who live in rural areas or have trouble getting around. Telehealth appointments have also proven to help better manage chronic diseases such as high blood pressure, diabetes, or heart failure. If you are recovering from a procedure or illness, telehealth lets you check in with your doctor while still recovering at home. And finally, telehealth visits keep you safe at home during a pandemic. By avoiding an in-person appointment, you are also avoiding the risk of exposure to infection and illness. There are two types of telehealth visits, a virtual physical appointment or a virtual sick appointment. A virtual physical appointment is where you can review with your doctor your medical history and any changes in your health. For example, your current diet, sleep, or exercise habits. You can also talk with your doctor about any labs you have had done or review any medications you are taking. If you have a pill organizer, your doctor may want to look at it. Says Dr. Todd Zartowski, Chief Medical Technology Officer at Providence Health System, doctors can learn a lot by seeing a patient in a natural setting such as their home, as opposed to a sterile office environment. At the end of a virtual physical appointment, your doctor will talk with you about an ongoing plan for your care. During a virtual sick appointment, a doctor can diagnose common illnesses based on your medical history and any current symptoms you are having. For example, if you are having stomach pain, you may want to wear pants with an elastic band so you are able to easily show your stomach to your doctor. Your doctor may ask you to take some deep breaths, ask you to feel along your jawline to check for swollen lymph nodes, ask you about any sinus pain, or ask questions to check for an infection. Says Dr. Susan Bailey with the American Medical Association, there are a lot of visual and auditory cues a doctor can use to evaluate a patient. I'm able to listen to a patient cough, rapid breathing, wheezing, and hoarseness.